What is laser ablation for surgical wart removal? Imagine a precise way to remove stubborn warts that refuse to go away with creams or other treatments. Laser ablation is a medical procedure that uses a focused beam of intense light, called a laser, to target and destroy wart tissue. This method works by either vaporizing the wart cells on the skin's surface or cutting off the blood supply that keeps the wart alive. When the blood supply is cut off, the wart tissue dies and eventually falls off. The most common lasers used for wart removal are carbon dioxide and erbium lasers. These lasers emit far infrared light that penetrates the skin and vaporizes the watery cells in the outer layer where the wart resides. The procedure is usually done in a doctor's office or clinic, often under local anesthesia, especially if the wart is large or multiple. The process creates an open wound that typically heals within 1 to 2 weeks. Most people need only 1 or 2 treatment sessions for effective removal, but some cases might requiring additional visits. Because laser ablation targets only the wart tissue, it can be very effective for warts that are resistant to other treatments. This is especially useful for genital warts caused by human papillomavirus, which is a common sexually transmitted infection. It's important to remember that while laser ablation removes visible warts, it does not eliminate the underlying virus. Human papillomavirus can stay in the skin, and new warts may develop later. That's why laser treatment is often part of a broader management plan that includes monitoring, other treatments, and preventive measures like vaccination against HPV. The benefits of laser ablation include its precision, effectiveness for difficult or large warts, and relatively quick healing. However, there are some risks. Patients may experience pain or discomfort during and after the procedure. There is also a chance of scarring, especially in people prone to keloids, and the wound could become infected if not cared for properly. Skin pigment changes can also occur, particularly in individuals with darker skin tones. In summary, laser ablation is a surgical technique that uses laser energy to destroy wart tissue and its blood supply. It is a useful option for removing warts, including those caused by HPV, within the scope of sexual health and STD management. If you are considering this treatment, it's essential to consult a healthcare professional to determine if it's right for you and to ensure proper care before and after the procedure.